Today we'll talk about how we can reduce the risk of dementia. So dementia commonly causes loss of memory and other important brain functions, and in most cases it continues to get worse over time, and at present there is no cure. And if there is no cure, it is always better to look for the ways to prevent it, because prevention is always better than cure. And as the lifespan and longevity they are increasing, we are expected to see more and more people with dementia in the coming years and future generation. So what are the things you can do to lower your risk of getting dementia? So let's look at some of the lifestyle related factors which can make a difference. So number one is physical inactivity. So it is well known that people who are less physically active or those who are more sedentary, they have a higher risk of getting dementia. So the important thing is to keep moving, move, walk, or do any kind of exercise. So that not only improves the blood flow in the muscles, but also the blood flow to the brain. Second thing is, the most important thing is sleep. So it is known that those who are chronically sleep deprived, so those who sleep for lower than 7 hours and lesser the sleep duration, higher is the risk of dementia. So one has to ensure 7 to 9 hours of sleep at night, good sleep, and this will definitely lower the risk of dementia. Third is, if you look at many of the vascular factors, risk factors, like those who are overweight or obese, they again have a higher risk of dementia. And it has been shown that people who have excess visceral fat or abdominal fat or adiposity, if you follow them up, then there is more brain shrinkage on the MRI in the future. So if you are overweight or obese, it is helpful to lower the body weight through healthy diet and exercise. Other vascular risk factors like diabetes, high blood pressure, and high cholesterol. So these three risk factors, they not only increase the risk of stroke and vascular dementia, but they are also linked to a higher risk of Alzheimer's disease. So if your blood pressure, blood sugar, and cholesterol are on the higher side, it is helpful to bring them down. And then it is also helpful to have healthy diet. So when we say healthy diet, means some things are known to be unhealthy, like ultra processed packaged foods that contain high amount of carbohydrates or sugar. So they need to be avoided. And there are some foods that are known to be healthy for brains. In that we have handful of nuts, berries, fish. So some of these foods are definitely healthy. And we know that vitamin B12 deficiency can increase the risk of dementia. So foods that are rich in vitamin B12, like mostly non-vegetarian food, eggs, some amount in the dairy also, and those who are vegetarians, because plants do not have any vitamin B12, so they need to take B12 supplements also. So lack of B12 can increase the risk of dementia. So one should have adequate amount of B12 to lower the risk of dementia. And two other lifestyle related factors are alcohol and smoking. I know that some people debate that small amounts of alcohol or some red wine may be helpful or may be healthy. But if you look at the brain, no amount of alcohol is safe for brain, and alcohol is neurotoxic, so it will damage the brain neurons. And we have seen that people who drink excess amount of alcohol over a long period of time, they have shrinkage of brain and they can get dementia. There are other mechanisms also, like alcohol. People who alcohol abuse, they have thiamine deficiency, so they can get syndromes like Wernicke's encephalopathy, and they can have memory impairment also. So definitely it is not a good thing to consume alcohol. Same thing for smoking. So smoking also can increase the risk of strokes and vascular dementia as well as other causes of dementia. So it is helpful not to smoke. And then few things in the daily life, like excess of sitting or sedentary lifestyle or watching TV. So it has been shown that watching TV for long hours for a number of years will increase the risk of dementia. This is possibly because while watching TV there is no stimulation to brain, it is totally passive. Whereas if you do something which is interactive, so if you play some kind of video games or solve crossword puzzles or sudoku or socialize and talk to people, so they definitely have a better or positive impact on the brain rather than a passive thing like watching TV. Then the role of stress. So small amount of stress for a short duration may be harmless, but if somebody has severe stress which goes on for months to years, then definitely it can increase the risk of dementia. And a few things which are also known is that hearing impairment and visual impairment. So they also increase the risk of dementia, and that is because if somebody cannot hear, if they can't hear, they can't respond. So the stimulation to brain reduces. Same way, if somebody cannot see clearly, again the stimulation to brain through visual cues will reduce. So we should screen periodically for hearing impairment. If there is hearing impairment, then hearing aid may be helpful. If somebody has visual impairment due to cataract, common in older people, then the surgery and cataract treatment can be helpful. So the vision and hearing should be normal, and normal vision hearing will lower the risk of dementia. And one more thing is the air pollution. So we talk about pollution. Pollution is harmful in many ways because they increase the risk of lung diseases, chronic obstructive lung disease, asthmatic illnesses. They also increase the risk of high blood pressure, diabetes. And one more thing is they also increase the risk of dementia. So we should be mindful and try to reduce the air pollution, at least exposure to the outdoor air pollution. So I think these are some of the things one can do to lower the risk of dementia. Obviously we cannot reduce 100%, but if we follow all these protocols, then a significant amount of dementia can be reduced.